Jessica Rose from Canada, supposed to appear on our screen. Hello, Jessica. Can you hear us? We cannot hear you. Yeah.
That's because I forgot to unmute.
Okay, thank you. Now it's good. So very welcome, Jessica Rose from Canada, and you will tell us a lot about vaccines today. And we are looking forward for your presentation. Are you ready?
Yes, I am. I have an echo, so I'm going to try and ignore it on my end. But can you guys hear me okay? Only one version?
Yes, it's all good now. So
All
you
right.
welcome. You can start with your presentation.
Okay, I'm just going to share my screen. That's really annoying my echo. That was great, Martin, by the way. Hi. One day we'll meet in person. Okay, can you see my screen?
Yes. It's all good.
Okay. I will proceed then. Thank you, first of all, for inviting me to speak. I am quite honored, and I hope that nothing else, everybody leaves with a new piece of information for my short presentation today. I'm going to do my best to summarize what I've learned about potential contamination, the mRNA injection, and I'm also going to discuss some RNA integrity issues, and just briefly discuss what the implications might be for the adverse events. As most of you know, I've been studying the vaccine adverse event reporting system from the US, VAERS, so it's a reflection of what's going on, and amazingly, after 3 years, we still don't know what's in these shots. So, I mean, if we were privy to what's in them, if we were privy to test each vial or every 100th vial, and to sequence the RNA, maybe we would have a better idea of what we were dealing with here. So the big question that everybody wants to know, and I do mean everybody, I literally mean everybody in the world, is what's in them. What's in the COVID, Moderna and Pfizer shots specifically? These are the mRNA shots. And a very important question to ask, because of what we've discovered recently, as colleagues, is are there contaminants? Are there metal contaminants? Is there lipopolysaccharide, which is otherwise known as LPS from E. coli? This is an endotoxin. Is there double-stranded DNA? So I'm going to discuss some of these ideas herein. And to start, I just want to make sure we're all up to date on what's supposed to be in them, because we've been told that we've been given this ingredient list on the left here that you see. And this is basically the same ingredient list for Moderna and Pfizer. The first two are, the most important. Without them, we wouldn't really have this new technology. And so the first one is the lipid nanoparticle, which is the package that delivers the second main ingredient, which is the modified messenger RNA. Without this packaging, this fat bubble, to protect this messenger RNA, in theory, we wouldn't have this technology. We wouldn't have these products on the market. So they're kind of, at this point, to my knowledge, very interlinked. And the primary ingredients in these two products, the Moderna and the Pfizer products, the rest of these from 3 to 8 are basically, I'm not going to go into the details of what they are, but they're basically just pH balancers. They're used to balance the pH of the solution. So I'm going to go into a little bit of detail into what the lipid nanoparticles are and what the modified messenger RNA are as well. And just to reiterate here, the mechanism of action that we've been told that's supposed to go on here is the introduction of the single-stranded messenger, the single-stranded messenger RNA for translation by the human host cell ribosomes to the spike protein. And that therefore becomes or is translated into this antigen protein, the spike protein, and the subsequent immune response ensues. Once it sees this foreign protein, it launches its attack. And I'm not going into detail as to what that attack entails, but that's the design, that's the mechanism of action. In theory, it sounds great, but too many questions remained before they injected very, very, very many people. In this ingredient list, there is no mention of any kinds of metals. Aluminum, for example, is often used as an adjuvant in vaccines, which these are not. I have never referred to these as vaccines. I call them injections. But there's no adjuvant in these per se. There's no mention of LPS, and there's no mention of double-stranded DNA. So the lipid nanoparticles themselves are the carriers, like I said. And both of these manufacturers have their own recipes, but they both constitute 4 different fats, 2 of which include polyethylene glycol, which is otherwise known as PEG, which is the coating on the outside of the lipid nanoparticle fat bubble. And this enables and optimizes a movement around the body. And PEG is actually known to have an allergenic, it's got an allergenic profile in the literature. It's not a secret. We know this. If you've had previous exposure and developed antibodies, for example, secondary exposure can induce anaphylactic shock. So this is not a secret. We even have cases of certain vax lots in Moderna, which were more highly associated with anaphylaxis. So we know this already, which makes it kind of, question markable. And they also have a lipid called a cationic lipid, which has a known toxicity profile. This, from my research, has been one of the biggest problems that the researchers have had to solve over the last 2 decades, at least. To override the toxicity profile of the cationic lipids. These are an ionizable version, which means that they are active only at specific pHs, which apparently solves this problem to some degree. Now, I'm not sure about that because I can't find a safety data sheet for either the ALC0315 or the SM102 that does not clearly have marked on it not for use in humans or veterinary use. So I think this is strange. I haven't gotten a good answer to my own question, are these things actually safe? Because I can't get past these 2 main points. The cationic lipids do have a documented toxicity profile, and PEG has a documented allergenic profile. So these lipid nanoparticles are the delivery vehicles for the modified mRNA. And these are specifically modified in very, very intentional ways. They're codon optimized for maximum or optimal translation protein expression in humans, first of all. They have 5' caps, which optimizes targeting to ribosomes for translation, which also optimizes translation. And they have long poly A tails, which makes sure that they're very, very stable and durable. And remember what everybody was saying about these things being fragile and they need this delivery vehicle and they break down really easily. Well, no, that's not so true. These things were manufactured to be very durable, and it turns out from the literature that they are. We have found traces of RNA and spike protein in the germinal centers of lymph nodes up to 60 days after injection. So we have published peer-reviewed journals that indicate that these things are very, very stable and durable. So way to go, guys. You succeeded. The byproduct, of course, after translation of the mRNA is the spike protein, which is a foreign synthetic protein. It has specific modifications as per, the working around the nucleotides, including all the uridines having been substituted out for pseudouridines, which makes this this invisible to the innate immune response. That's the mRNA. And as per the spike protein, we have two specific modifications to prolines, which keeps the spike protein in a closed conformation, which they claim makes it very durable, more resistant to degradation. I dare say that it also, their goal was to make sure that this wasn't going to bind its cognate ligand, which is ACE2. Because that would be really bad. Imagine you have all this spike protein circulating and binding the ACE2 receptor, which is involved in the renin-angiotensin-aldosterone pathway and downstream signaling events occurring. I'm not absolutely sure that's not exactly what's happening, which is causing a lot of problems, but that's not what we're going to talk about today. There are also sites within the spike protein that have been deemed as potentially amyloidogenic, which means that they can produce amyloid plaques. There are molecular mimics. There is the furin cleavage site, which strangely enough is not found in the original SARS virus. And all of these things, in my opinion, at this point, after 3 years of looking at this, are highly suspect. And there's a lot of clear evidence that indicates that these were actually inserted intentionally. The question is why, and it will remain that way. Safe to say, what my message for this slide is that the modified mRNA and the spike are stable, they're durable, and they're synthetic. The spike is highly immunogenic and inflammatory. This is not refutable at this point. So it also begs the question, why on earth were the people who made these products not thinking ahead as to this definitive property of spike? So what's actually in some of them? This is a workflow of how we get from in silico, the computer, to the purified mRNA. So I'm not going to dwell on this. I just want everybody to kind of have an idea of what's involved in producing the mRNA, the modified mRNA that ends up in the lipid nanoparticles. So first we have to design our construct, our DNA. So this comes from knowing what your virus is and designing something in your computer. And you can also use, at this step, you can optimize. You synthesize your DNA, and then you clone it into a cloning vector, whatever vector you choose in whatever company you're working with. And then you use this vector, this expression vector. It's called an expression vector because it's used to express the gene of interest. In this case, it's the spike protein. And you make lots and lots and lots of DNA copies of this using E. coli as a means to do this. This is the model system that we use oftentimes in the lab to make more and more and more DNA, more plasmids, for expression of a gene eventually. And then we have in vitro transcription, which involves a promoter. Usually in the case of prokaryotes, we use the T7 promoter with T7 polymerase. Don't need to go into detail, but this is very important as per the steps to get to our final result, which is or product, which is our mRNA. And this is a very, very important step. And from my reading, this is the most expensive step to purify the mRNA from your your mélange. This is very important, though, as you can imagine, because you've got a lot going on here. You've got DNA, you've got E. coli, which means you've got LPS, you've got all these things that you want to make sure aren't in the final solution or product. So bear that in mind. mRNA is meant to be the only final product of this process. So what about double-stranded DNA? So I'm jumping right to the punchline here. A colleague of mine has independently sequenced he started with the bivalent products of Pfizer, I believe, actually maybe both Pfizer and Moderna, and moved on to the monovalent products of Pfizer and Moderna, and found double-stranded DNA contamination, the expression vectors, in all of the samples, rather. I think he tested 8 vials of Pfizer product. He found in 8 vials contamination. And we're not talking about low levels of contamination here. We're talking about orders of magnitude higher than EMA limits, the European Medical Association. So the long story short here, without getting too detailed, I just literally want to create talking points with these slides, is that something that really shouldn't be there is there. According to his work, this isn't even refutable. And it's not just there, it's there at really high levels, like 20 to 35% of the nucleotides or the expression vector. It's not supposed to be there. And then the obvious question that follows is, what is going to happen due to their presence? How many vials actually have this expression vector? Is it all of them? Is it just by batch? Who knows? We need to answer these questions. Some other again, I'm just dropping little nest eggs here for people to nestle down into and research. My friend, my colleague and friend who I've been working with and having discussions with for years now, he also found in the expression vectors, which you can see shown on the right here, some other, I would call them disturbing findings. Remember I said that for prokaryotes like E. coli, you use the T7 promoter? Well, he found that there was another kind of promoter called the SV40 promoter, which is the simian virus promoter. Not only did he find this promoter, and by the way, this is a promoter that's more readily used in eukaryotic systems like mammalian cells. But he also found the enhancers. Now, you don't have to know anything about this to understand what I'm going to tell you. In my reading, I found out that when you use the SV promoter in a lab to promote transcription of a gene, you don't need an enhancer. You can add one to your plasmid in order to enhance transcription, but you don't need it there. It's not necessary. So it begs the question, why is there an enhancer in this plasmid that already contains a questionable promoter? It's very weird to me and very disturbing. And again, this really needs to be, his work needs to be replicated by independent labs, and these very important questions need to be answered. Now, the potential physiological repercussions are multifold, and I'm not going into them. I'm just going to show you some data and then move on to the percent RNA integrity. But there's a potential for continued expression of spike genes and prolonged spike expression because of these things that he found in these plasmids that are in the products themselves that are being injected into people. One of the byproducts of the presence of LPS, which is standardly, as a standard, tested for in products that are manufactured for, say, vaccines, one of the byproducts, if there is contamination, is sepsis or toxic shock syndrome and anaphylaxis. Because we're talking about DNA here, we're not even talking about mRNA here, we have to wonder about integration. There's a whole debate going on as to whether or not the fact that this reverse transposon, which is endogenous to humans called line 1, which does allow for the reverse transcription of the mRNA. The question becomes, does this get integrated into the genome, therefore? But here we're talking about DNA. We don't even need the reverse transcription step. So big question mark there. And cancer. This SV40 is a tumor virus, and it expresses dominant oncoproteins, and they bind and inhibit the guardian of the genome, P53. So I'm not an expert in this, but from what I've read so far, if this promoter doesn't have two specific mutations, then it does bind. And what that means is that it's going to inhibit P53. You see where I'm going with that? These are really, really serious questions that need to be asked. I'm not saying anything like definitive here because I honestly don't know. That's why I'm bringing this up, because people who are experts in these fields need to know that this is going on so that they can go back to the lab and figure it out. But just so that you know, from my point of view, because I'm not in a lab right now, the cancer reports filed to VAERS are quite prolific. They do seem to be skewed toward 70-year-olds, so this is older people, but not only in this age group are we seeing cancers. And I'm also going to point out that according to VAERS, we're seeing many reports of rare cancers like breast cancers in males and acute lymphocytic leukemia in adults, which is weird because it normally is reported in children. So what about LPS? Bacterial endotoxin levels are often measured, as I said, in products that are meant for injection, let's say. Also pharmaceuticals, I dare say, or anything that involves the use of E. coli or a potential contamination from anything used in the methodology that might say have LPS. So this is the most recent document released by the FDA. This is for Spikevax, which is the Moderna product. And I cannot wrap my head around how it's possible that there are any redactions here apart from the stuff that they claim is proprietary or a trade secret. Bacterial endotoxin levels are not a trade secret. They're a lab result. And it's really important to disclose what the levels were if they measured them. They either didn't measure them, and so there's nothing to report here, or they did, and they were acceptable levels, whatever that means, or they were not at acceptable levels. But we don't know because it's redacted. It's ludicrous after 3 years that we still don't have this basic information, because we know that the way that we produce the mRNA is using the system, so we know that this is a potential, danger. We know that. So just as leaves rustling in the wind, from VAERS again, the anaphylaxis and toxic shock syndrome reports in VAERS look like this to date. And I don't normally report on vaccine lot because the data is really bad and it's hard to draw any conclusions, and I never really do. But just to let everyone know, because I was kind of suspecting to see at least one of the Moderna lots in the top 3 associated with anaphylaxis, because there was this batch that was alerted in California as to having been more highly associated with anaphylaxis way back when. I think it was 042 L2A or something like that, 041 L2OA or something like that. But what I found was that the top 3 were all Pfizer, and they're not high. It's not a high number of reports, but they are clustered when you look at it in the context of the other data. Again, I don't normally report on VaxLot data because, most of the reports didn't have any, but you can see here, the reports are distributed across all ages. They're kind of clustered around the middle age groups, and there are a lot of them. Is this from PEG? Is it from polyethylene glycol, like I had mentioned before? Or is this a byproduct of LPS? We don't know, because we're not privy to know. What else is in them? So now I'm going to pivot to percent RNA integrity. This isn't really about contamination per se. This is more about, I guess, purity. Again, in the SpikeFacts document, the percent RNA integrity level of whatever it was they tested here is redacted. We don't have the level, which seems very strange, because even Pfizer has come out publicly and said we need a sufficiently intact RNA molecule in order for our product to be efficient. And the relevance of RNA integrity is clear. I'm not going to read this, as I said. Some of my slides are just for reading later. But we need proper expression of the antigen. Otherwise, the system's not going to work. I mean, it doesn't take a rocket scientist to follow that line of thinking. It's very important to have at least a certain percentage of your RNA intact. Now, when I say RNA, I'm talking about this messenger RNA. It's a certain number of nucleotides that needs to be there. So there was a leaked document from the EMA, the European Medical Administration. I think it's administration. It might be authority. Beg my pardon. That did an investigation, and it discovered that there was a difference between the percent RNA integrity of clinical versus commercial batches, and it was quite large. There was like an 18% difference when they tested 4 batches of each. And of course, the potential implications, we don't know. Still yet to be defined. I'm laughing, but it's not funny. The commercial batches are the ones that are going into people. And they had an 18% lower integrity than the clinical batches that they tested, which still didn't really have that high of a percent RNA integrity. And at the time that this was done, the cutoff for administration to people was 60%. So this actually fell below the cutoff. I'm going to get to that. I'm going to throw this in though, because this surprised me. I ran my little algorithm to see if I could find any of these 4 batches, commercial batches in VAERS, and 2 of them popped out, the EE ones at the bottom. And there are quite a few reports. There are 1,209 reports here. And shockingly, more than a quarter of them were associated with severe adverse events. And I know I haven't mentioned this, but according to the VAERS handbook, the average percentage of severe adverse events as per any group is 15. So this is well above the average as documented by the VAERS handbook. And 4 of these were deaths. Kind of makes you wonder like how they got into people. They lowered the acceptance criteria. That's what happened, according to these people who reviewed this data. Their names are at the bottom of this chart here. They lowered the acceptance criteria to 50%. Therefore, they could make it okay to put an average of 59% RNA integrity commercial batches into people. All right. It's not all right at all. And it's been quoted to have said by one of the people involved here that the possibilities for unwanted immunological events are very, very clear cut. And I don't think it takes a lot of predictive ability to anticipate that, because, I mean, I'm not sure everybody can imagine this at this point, but let me paint a picture for you. If you have a low percent integrity of your RNA, let's say your RNA is supposed to be, I don't know if you can see me, this long, and let's say it's only this long, which means that it only represents, say, half of what it's meant to, in order for it to be translated into a full template protein, which are pretty much, I mean, give or take, going to end up with is half of a protein, which isn't the target protein, or fragments of that target protein. And when that gets translated and introduced to the body will see them as foreign, but we don't know what other effects it's going to have because we don't exactly know what other peptides are involved here, as I'm kind of alluded to in the beginning. So unwanted immunological effects are very concerning. And one of the very, very first things when I started looking at VAERS that I noticed was a convergence, an absolutely systemic nature of adverse events that were being reported. No system was not involved. The cardiovascular, the neurological, the hepatological, the immunological, every single system and every single organ was involved in the people who were reporting adverse events. And the one thing that kind of came to my mind, maybe it's because I have an immunology background, but was that if something immunologically, if something becomes dysfunctional immunologically, it is going to manifest in many, many, many other systems, especially if you have targeting of your product, the lipid nanoparticles, to the liver, because the liver is very important in many, many, many biological systems. So this is on the right, a chart of the absolute counts. So this is the number of people that reported an immunological related adverse event. This is from autoimmune conditions to what have you. There's almost 500,000 of them. I didn't normalize this on purpose because I want people to realize, the ones who don't, that these are not data points, these are people. Every single one of these numbers here represents a person that managed to file their report to VAERS. And it's not an easy task to do this. Another thing I haven't mentioned because of time restrictions is that I never incorporate the underreporting factor when I talk about numbers in VAERS. There's no need. The numbers are horrific already. But these numbers are underreported severely. We don't know by how much, but my most conservative, my estimate is the most conservative, which is based on a calculation that I did using Pfizer's phase 3 clinical trial data for severe adverse events, and it's 31. So that's the most conservative estimate I know, which means that you have to multiply these numbers by 31. To get an idea of how many people are actually suffering. These products aren't stable after 6 months. That's why they have an expiration date. They tend to degrade after a certain amount of time. This isn't a secret. There is a publication that's been put out that actually clearly shows how they degrade if they're exposed to multiple freeze thaws, for example. The lipid nanoparticles degrade. Has an effect on the mRNA as well. Interestingly enough, it seems to me that it would bode better for people if they did have a degraded product, because then it wouldn't be effective. But let's leave that aside. Those are just my thoughts. I guess you're wondering, are expired batches being injected into people, and is it resulting in more or fewer reported severe adverse events? And indeed, as you see this big spike, and these are 5-year-olds, in reports that are being filed by people in the US with expired products. I mean, I'm laughing, but it's not funny laughter. It's nervous laughter. This shouldn't be happening. This is what goes through my mind when I think about this. The administrators, they're supposed to be telling people about side effects before they inject. They're supposed to be providing and receiving informed consent. They're supposed to be injecting people who are of a certain age, according to, these regulators or whatever they are. Imagine they're not even looking at the labels. They're not even checking that little vial before they stick that needle into it and suck some out. By the way, they're not even diluting the product in many, 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 many cases. I'm not showing that here, but it's true. They're not looking at the expiry date. what makes anyone think, if they're not looking at the expiration date, that they're telling anyone that their kid who's 9 years old has a very high chance of developing myocarditis? Next to none. Yeah, so this is just an interesting pause chart that I made. So I calculated the number of severe adverse events that were being reported according to the distance between, or the number of days between the manufacturing date on the vials, which I had access to, and the injection dates, which basically is like a measure of freshness, like how soon after that vial was made, not opened, but made, was it injected, and how does that, if at all, associate with severe adverse events. And it's kind of interesting here that the biggest cluster of severe adverse events does occur between day 30 and 60. So it does seem like there's an association between severe adverse event occurrence and the freshness of the product, which kind of makes sense in a way, but there's a lot to talk about there. I mean, we'd have to discuss how that person was injected, if they were aspirated, their immune state at the time, whether it hit a blood vessel, blah, blah, blah. All these things, these factors, these cofactors that will affect the outcome need to be assessed. But moving right along because of time, are there medals? Yes, indeed. I'm not sure everybody here has heard, but in Japan, there were 2 men that died, young men, and it was reported that there were metallic substances found in the vials. So they pulled a whole bunch, like millions, I think, of Moderna product from their market. I just looked at contamination in general as a keyword in VAERS, and there were just a few reports of contamination. But again, maybe I'm missing out on the right keyword. But notably, there were 3 for general metal. I didn't look for specific metals. I know that there are many, many, many more that report nickel, but I don't report that here. And 2 of these people died. And this is another thing about VAERS that I could talk for 2 hours about, but I'm just going to mention here. These 2 people that died were reported in a single VAERS ID, and this is a common occurrence in VAERS. Oftentimes, multiple deaths, especially deaths, will be hidden in one report. This is another reason why you have to consider multiplying whatever the numbers I'm telling you are by some factor. Not all the time. We need a basis to do so, but I'm just letting you know. So we've all heard about the speed of science. The reason why we're in this boat, the reason why we don't have answers to all these very basic questions, is there double-stranded DNA in the vials? Is because we've been bullied, really. There's no other way to put it. The clinical trials weren't clinical trials. They were theater, in my opinion now, after looking at all of this data. It was just to kind of give the impression that clinical trials were done. They've moved on to already the next stage where clinical trials will not have to be done. They moved from testing on a few people and making it look like they did sufficient trials that showed safety and efficacy to a few mice and then nothing. And all the future technologies, and this includes self-amplifying mRNA, which is also another 2-hour lecture, will not need any human testing, no trials. The speed of science. So what's in the COVID, Moderna, and Pfizer shots after all of that? We don't know. We still don't know. But evidence suggests that there's a low % RNA integrity, which could bode well, or it could be bad, we don't know. And contamination with at least double-stranded DNA, we know that, and possible lipopolysaccharide. The effects of all of these things, alone and together, in the context of populations of people who were not included in the exclusion criteria list in these so-called clinical trials are completely unknown. I have no idea. And this is probably why we're seeing these horrendously high numbers of reports of adverse events ranging from death to neurological defects, children getting myocarditis, all of it being normalized. Nothing to see here, folks. So that's the end of my presentation. I hope it wasn't too depressing. If you'd like, I do some writing sometimes in my Substack newsletters. I have a website that I try to keep on top of, which updates the VAERS data, which is updated weekly. This is a government database, it's their data. And I also have a Twitter account, which I try to stay away from. So I want to thank you all for your attention. Again, I hope it wasn't too depressing, and I hope you have an amazing experience there all together. And make sure you hug, because I'm here and I'm not able to. So hug each other.
Thank you very, very much, Dr. Jessica Rose. Can you hear me?
Yes.
Okay. And we really appreciate your effort, what you are doing in all your research in mathematics, molecular biology, biochemistry, and so on. And you are our lighthouse where we can get the information, because this information has really been hidden from us. And I guess people today got like very, very important information. So, but we are running out of time, and we thank you very, very much once again. And it was a real pleasure. And next time, as you said, you will be on the spot when we have something happening. So, but thank you very much.